Hey everyone, and welcome to Startup Savants. I'm Annaka.
And I'm Ethan.
If you're a returning listener, welcome back. And if you're new, this podcast is about the stories behind startups, the founders who run them, and the problems they're solving. This episode, we're joined by Troy Bannister of Particle Health. Troy is the founder and CEO of the company with an extensive background in various medical fields before choosing to launch Particle Health, his solution to what he identified as a major pain point in the industry.
So in today's chat, Troy gave us some strong insight into building a company for those in a highly regulated sector. He also did a deep dive into the entrepreneurial mindset, which I think is going to seriously resonate with a lot of you.
The fun part for me is that I got to learn about a different structure called OKR, or Objective Key Results Structures. We also talked about building a burnout-resistant culture and how hiring the right people does more for company culture than a ping pong table. This is one of our best interviews yet, so don't go anywhere. Hey, Troy, welcome to the show.
Hey, thanks for having me.
We are grateful to have you joining us today. And if we could start off, if you could tell us the story behind launching Particle Health and the problem y'all are solving.
Yeah, so the short version is my math teacher in high school always talked about being an EMT and told us these crazy stories. And so one of the first things I did when I got to college was sign up for the EMT class. And at the time I was in business school, which was kind of boring. And on the weekends and on the summers, I was working in an ambulance. And I absolutely fell in love with medicine when I was doing that. I was 18, I was driving an ambulance around Seattle, and I was part of experiences of all these people in a position to help, and I loved it. And so I ended up switching to pre-med, going to med school. At med school, I relatively quickly realized it was not for me, which is a very hard decision to make at that point in the path. But I switched out and got a master's degree in biophysics and physiology. Took that, did clinical research for a few years in New York, and somehow got pulled into the digital health world. They were doing some really simple stuff like text message reminders to take your medications, and they were proving like 20% of people don't go to the ER if you are reminded to take your meds on time. And I was like, this is a big deal. Nobody's using the internet or cell phones for healthcare. And so I joined a small venture firm out here in New York and got really involved in the digital health startup ecosystem. And when I looked back on my whole career, I just saw this consistent issue where no matter where I was, in the ambulance, the hospital, doing research or working with entrepreneurs, nobody had access to clinical data. The best option was the fax machine, and still is, funny enough, today. And so I saw this really clear issue no matter where I was, and the issue spanned the entire, healthcare ecosystem. And I thought this is a problem worth solving. And so I jumped in and put my boots to the ground and started going.
So you've been in the healthcare space for quite some time. And first off, thank you for doing the EMT job. I cannot imagine how hard that job is, but it's so necessary. So thank you. So it sounds like this problem is something that you had identified quite some time ago, and you had seen it increase over time, or at least not decrease. What was there a specific event or set of events that led you to choose to be the one to solve this issue?
I think there were two moments. One was when I was at the venture firm, I was working with a handful of entrepreneurs that were all trying to integrate with the same hospital. I think it was 3 companies and 3 CEOs that I was working with. And all of them were doing the integrations separately. And they were spending 6 to 9 months and maybe $100,000 to $200,000 to do it. And I was like, why? Why are all 3 of you building the same thing? If someone just built that thing and everyone could use it, this would solve the problem. It's really hard to do. I knew that, but what a great problem to solve. The other was a more, interesting moment. I was in San Francisco for the JP Morgan Healthcare Conference event. I was in this small room with maybe, 100 or 200 people, and we were listening to Joe Biden who was then the acting vice president back in whatever, 2009 or 10 or something. And he was telling us the story about his son, Bo, who was diagnosed with a glioblastoma, brain cancer. And Joe Biden took his son to several different cancer specialists and was telling us the story about how they couldn't get his son's medical records from one specialist to another. And I was sitting there and I was like, if the acting vice president of the United States cannot get his son's medical records from one doctor to another, we have a serious problem.
Yeah.
And for me, that was a really interesting thing because I wanted to understand why. Why couldn't it happen? It seems like he could call somebody and make it happen, but apparently he couldn't. And so is it a technical problem? Is it an economic problem? Is it a legal issue? What is it? And so that got me really interested in the problem space. So I think those two things, seeing those two things, one in like the individual basis and one in the systemic basis were the things that pushed me over the edge.
So the issue that Particle Health is solving is allowing the sharing of medical records between different institutions. What's the product? How is Particle Health solving that issue? So
the best analogy today is if you've ever used Venmo before, which I'm sure you have, there is a company behind Venmo called Plaid. And some people know Plaid, some people don't. Mm-hmm. Plaid is a large network of integrations to all the banks in the United States. And that infrastructure is what Venmo uses to move $5 from your bank account to $5 of your friend's bank account. That doesn't exist in healthcare. There's no unification of the systems. And so what Particle does is very similar. It's an API, just like Plaid, that connects to all the practices, hospitals, clinics, labs, and now increasingly digital health companies, and shares data across all of them. And it's directed either by providers or consumers or whoever's using that tool that we plug into.
Awesome. So now we know what helped you to identify the problem and what made you decide that you were the right person to go and solve the problem. So after you started your company, how did you know that it was time to quit your day job and focus full time on Particle?
Well, one correction there. I quit without a plan. So I was 3 years in to this job at this venture firm, and it was a good job and it was a great company and we were doing cool stuff. But as I mentioned earlier, I had this nagging feeling that I needed to do more. I needed to have free agency. I needed to take my own risks and either pay for those risks or, cherish the wins that I did, fulfill. And so, as I mentioned, I one day just stood up from my desk, walked in my boss's office, and I was like, 2 weeks, sorry. And I had no plan. I didn't even know I was going to start a company then. I just knew this wasn't the right place for me. And there was something else that I needed to do. So as I mentioned, again, I went home and I paced in circles for like 2 weeks. I took 2 showers and was eating beans and rice and ramen every day, freaking out, freaking out. What am I doing? Why did I do that? I had no money at the time. I was 26, maybe 25, in New York, expensive rent. And I think this is a lesson that I would teach a lot of people that are interested in starting a company. The minute you don't have a backup plan is the minute you develop a really good plan. The paranoia and the nervous anxiousness forces you to get phone calls set up. It forces you to go to the cafe for 6 hours and read about what's happening in the ecosystem and what opportunities are coming, and it just forces you into it because you don't have an option anymore. There's no paycheck coming. And that was the catalyst for me, was this lack of a safety net that pushed me into starting this company.
Do you think that's a good idea for everybody, or do you have a specific advantage that allowed you to basically just jump off the cliff like that?
I definitely had an advantage. I think the principle of not having a backup plan applies to everybody. I think the nuance of how you do that is dependent on the person. I was lucky that I was living in an apartment with 2 roommates and I was paying $800 a month in rent, and I could just eat ramen every day and be happy. I didn't have kids. I didn't have dependents. I could kind of jump off that cliff. Other people can't do that. And so the question is, when do I jump off the cliff? Like, it's okay to start your company while you're working at another place, but at some point you have to jump. And the sooner you do it, the sooner you find the opportunity to do it, the faster this is going to go and the higher percent chance it's going to work.
So in starting your company, I imagine there is a ton of complexities and oversight in just the kind of the world of health data, especially like compliance and privacy. What were some major roadblocks that you ran into in the beginning, and what did you do to solve them?
Yeah, it's a great question. There is way too much complexity, and there's even additional wrinkles in that. That complexity is changing month over month. There are new regulations and new laws that have passed over the last couple of years that people still don't even know what they mean. The US is the only country in the world that creates laws but doesn't tell you how to do them. The private industry has to decide how to do that. And so we're in this interesting purgatory right now where the industry is deciding how to adopt these rules and make them happen and how to interpret them, and is waiting for precedents to be set. So anyway, rabbit hole we can get down later. In terms of complexities, the first thing we were trying to figure out is, how do we get access to everybody's medical data in a legal way?
Yeah.
And so that took probably a year for us to figure out, between saying, do we go hospital to hospital, practice to clinic, knocking on doors? That's probably not going to work if these two young guys are saying, hey, give us full access to your data. So then we found states. Every state has their own kind of body that is trying to connect data sources. So we went to the states and we actually ran some pilots with Michigan and Texas. And we realized those regulatory groups that are trying to manage this aren't very innovation oriented or revenue minded. And so that wasn't the right group. And then finally, we found some other organizations that were doing more national level work that we built into. And we were there very early in those iterations and have been kind of a big part of those evolutions. And so that's kind of baked us into a more national place. So that was a hard, long, journey from going from the bottom to the top of the stack and finally finding a place that worked.
I can't even imagine being like, you know what I'm going to do? I'm going to figure this problem out. And then no. So as far as your target market, who are you looking for to use Particle Health services?
So right now we sell to providers, and providers could mean a lot of different things, right? So some of our customers are actual provider groups or like hospital practices. So like Oak Street Health, One Medical, if you're familiar, are customers. More of our customers fall on the digital side, the technology side, diabetes management applications, telemedicine, digital pharmacies, all those types of groups we work with. That's the bigger customer set. If you're providing care to a patient and you're responsible for that patient and you don't have their medical records, you're at a disadvantage. And having their medical records clearly at your fingertips can help you prescribe safer meds or understand that this patient might have diabetes. And so you can use this data to improve the outcomes of your patients, whereas the groups that don't have access to the data can't.
Right. And what was the process like kind of narrowing that down? Because if you're like healthcare providers, that's a huge, huge group. How do you kind of niche that down so it's actually accessible and actionable?
There's a lot of niching happening. In the beginning, we think of it as the 4 Ps. There's patients, providers, pharma, and payers. And so which of these do we want to go through first? It was the first question. And we landed on providers for a few reasons that I could get into, but mostly because there was a direct line of sight on the value proposition here. It was really simple in terms of like what we're giving them and why. And so we started there. I think what we ended up understanding more clearly as we kind of started selling was there's 2 types of providers in this world. There's fee-for-service providers, where it's like you pay $5 for a telemedicine visit, and that's what it is. And then there's value-based care providers that get paid for keeping you out of the hospital. The better they perform and the better the quality of their services and their treatment, the more they get paid from the insurance companies. or Medicare, Medicaid, or whatever. That's our target group. Is we want to sell data to the providers that use it to keep people out of the hospital, not just to prescribe another medication for your rash or something.
Yeah, it's like I'm pretty sure I know what this is, but I just need someone to tell me that so I can get some medication for it.
Right.
I love that they exist though, because I'm a WebMD junkie. And
scary place to be.
Yeah, right? Oh my God. And we read in the research phase that you'd spent a year talking to people in order to validate your startup idea. Can you walk us through the decision-making process in there?
Yeah. It was all centered around this idea of how do we get access to everybody's records, and then why do we do that? What do we do with it? I wouldn't say it was a whole year. I'd say there was things happening in parallel, but I'd say the first year was, how are we doing this? How is this going to actually happen? When I started the company, it was just me. I was going to this coffee shop down the street every single day for 6 hours. I'd get one cup of coffee and use their Wi-Fi all day. They're like, oh, this guy's back. Okay. But my goal was fill up my calendar with phone calls and fill it up with people that can help validate my current thinking of what I wanted this to be. And so, the first 2 or 3 months was like 2 phone calls a day. And I was like, just twiddling my thumbs, reading as much as I could. The second, batch of months, maybe month like 4 through 6 or 7, I had like 5 phone calls a day, and like with more, subject matter experts in the space. And then by the end, maybe month 7 or 8, I had my whole calendar full every day with phone calls, and the phone calls were really valuable, and they led to, maybe a pilot or an investor conversation that was actually serious or something like that. And so, that was my goal, was just fill my calendar up every day if I could do it. And I like that method. I think it was a good method.
Yeah. And what would those phone calls look like? Were they to investors or just industry folk, or who are you talking to and what did you talk about?
I think it was a mix of 3 stakeholder types. One was the people that knew maybe how I was going to get access to data. Mm-hmm. Like, what are the regulatory opportunities? What other companies or organizations exist that we could work with? Things like that. Bucket 2 was potential customer types. Those were the groups where I was basically like fake pitching. I'd be like, look, I don't have a product, but like, let me pitch the idea to you.
Yeah.
We have this API, you put in their name, you get all their records. Does that sound good or bad? That type of thing. And then the last bucket was investors which was actually very similar to the customer types of conversations, right? It was like, what's the value? Why do I want this? Mm-hmm. X, Y, Z. So it was those 3 types. And I would just every time I'd have a call with somebody at the end, I'd be like, do you have anybody else that would be helpful for me to talk with? I'll owe you one. And 1 time out of 5 people would have a person or 2 for me, and that would fill up my next day's calendar or next week's calendar.
So your seed round was led by Collaborative Fund, which is a pretty well-known name in the VC space. And I think what our audience would love to hear is if you could walk us through getting into the room with Collaborative and what you did to craft a winning pitch.
So I think there's 2 things to take away from this. One is you have to build up credibility to the point where they're going to sit down with you and take you seriously. And the way you do that, I think there's probably 2 ways. If you're lucky, it's because you actually have a product that's working and you have like customers and revenue. That's hard to do. But if you have that'll get you in the door every time. The alternative to that is all the stuff around that. You are in an accelerator program with like a Techstars or something that is well known, or you have a co-founder that raised money in the past or had a startup in the past, or you are running a pilot with a well-known organization that you're working closely with. You got to figure out like what that little thing is that'll be like, oh, these guys aren't just messing around. They're actually working, and they have some indications that what they're doing is valuable. So as long as you have one of those things, you can typically get in the door, I think. I think the other piece is you don't ever really want to just do cold reach outs to VCs. Emailing them, LinkedIn, submitting a form on their website, that's not the way to go. only way to go is get introductions through somebody. And that could either be an entrepreneur in the portfolio or another investor that that knows them. They all know each other. So if you get one that is on your team, you can get a bunch more connected to you. So as long as you have those things, you can get on a call. The other thing to mention, I think, is when you talk about the winning pitch, the first pitches are not going to win. It's just not going to happen.
Yeah.
We had 2 or 3 sit downs with Collaborative Fund before they committed to investing. And the first one was like, what are you guys doing? And we're like, it's kind of this thing. And they're like, yeah, come back later. And the second one was, what are you guys doing now? And we're like, well, we kind of have this better idea of what we're doing. And we actually have a pilot set up now. And they're like, okay, let's talk after the pilot. And by the third one, we're like, we wrapped up the pilot. Here are the results. We're now integrating with a big national data source. We have one customer. They're paying us very little, but there's money coming in. And at that point, they're like, all right, like we're ready. So it's about building the relationship. It's about demonstrating progress. And it's about meeting the expectations that you're setting them. If you're sitting down with an investor, think if I have 3 calls with them over the next 6 months, and the third call, I'm thinking I'm going to have like a pilot done. That's when I'm going to raise my cash. We're not going to get lucky on this first call. They're not going to be like, oh, I woke up on the right side of the bed today. That's not going to happen. Yeah. Think about like, how do you build your relationship iteratively over 3 to 6 months? And what do you have to show them by that last phone call to get this thing done? So I think that's kind of my takeaway there.
So on that first call, let's assume that, you're not going to get it. But what do you need to bring? What do I need to bring to that pitch to guarantee that I get invited back? Because I'm assuming there's some people out there who get that first try and then they don't get invited back for a second pitch.
Yeah, I think it's 2 things. One is it's got to be a huge idea. Like this isn't like a $500 million company. This isn't a $1 billion company. This could be a $10 billion company. Set your eyes, set your targets on the next Facebook, the next Google. Is it realistic that you're going to get there? Well, statistically, definitely not. but try to think really, really big. Like, what could this thing be if everything went perfectly between now and then? That's number one, because investors aren't looking for doubles or triples. They're looking for grand slams every single time. So that's one. Number 2 is have a realistic plan. Like, come to them and don't say, we're going to have $100 million of revenue in the next 6 months. Come and say, we're going to have $10,000 of revenue in the next 6 months. And we've got 6 customers that we're talking to, and we think we could probably get one. And if we can get one by the next 3 months and we sit down with you, we would love to have that conversation, and we'll let you know when we have that contract signed. It's like, be really realistic and practical, and then prove out that you do it. If you shoot too big in your realistic plan and you miss it, now you've just missed the expectations that you've set. So show progress, show intelligent thinking, and hit your targets.
Those sound just like life lessons in general too.
Yeah.
I always learn
For
something
sure.
in these conversations, and it's like, how I can actually apply that to my overall life. So love that. And you'd mentioned in your company profile that COVID forced y'all to go remote.
Mm-hmm.
How did you facilitate that change?
Yeah, I mean, first it was really hard. We love working together. We were coming to the office every day. We're going getting dinner after work, and we're having a good time. Whiteboard sessions, water cooler talk. It was great. And then COVID hit, and we had to download Zoom. And all of a sudden, those water cooler conversations disappeared, and the whiteboard disappeared, and the drinks after work disappeared, and it was just on Zoom calls every day. And not only did the magic kind of subside, but also the really valuable conversations on the sides disappeared. And so there was, and by the way, at that time, we were starting to hire a lot too. We went from, I think, 6 or 7 people in the beginning of COVID to 35. Now 40 now. And so we had to introduce a lot of new ideas. And one of the big ones was what we call our anti-burnout policies. One is we have a summer break every year, and we have a winter break every year, and everybody gets those weeks off. And in between, there's still PTO, but we want everybody to take the same week off.
Yeah.
And refresh and recharge for the next 6 months. We also do flexible Fridays, which is just kind of like a no meeting day, a day to get caught up on your work. And if you're already caught up on your work, take it off. We don't care. You're getting your stuff done. That's awesome. So we have these kind of policies built in. I think now we have an office in Flatiron in the city, and we kind of think of it as like, this is such a silly term, but like a clubhouse, where it's like, you don't have to be there, but if you want to be there, 24 hours a day, it's open. If you want to meet at midnight and go over the product release plan, you can go meet there. Everybody's got the codes. And so we're trying to figure out a kind of more creative way of solving this problem, where people can have the water cooler talks if they want. They can have the whiteboards if they want, but they can also stay at home if they want. I don't think it's ever going to be the same, and that's totally fine. This is the world that we live in, but you got to think about how to kind of recreate some of these things, because they're wildly important things.
Yeah, as far as culture and people wanting to come to work. Do you see, because one of the things that I jumped on in I love looking through people's job postings, because it gives me an idea of like, who are the people you're actually looking to hire? And the anti-burnout thing was just hammered home on every single one. I was like, I have to know more. Do you think these things and these perks, are they just do you think those are sustainable, or do you think, when you're at 35, 40 people, you can do it, but maybe it get phased out as you get bigger?
I think these policies are not I actually think these policies are not super impactful at the end of the day, honestly. I think people that work really hard are going to work on Fridays, and they will probably work through summer break or winter break. Like, this isn't the long-term solution to building a sustainable business. That comes down to your actual culture. Like, are your managers demanding that you work on weekends? And is there a competitive culture where two people vying for the same promotion are going to work until they're burned out? Like, that's the stuff that you have to be really careful about, and that you have to ingrain in the culture. I think these policies are really nice, and I think the main point of them is a messaging that says we really think anti-burnout is a really important thing for us. And I think that messaging carries into, I'm going to shut my laptop today. I'm going to wake up and do this instead of miss my friend's birthday. Like, that's not what we want. This is a marathon in healthcare technology. It's not a sprint. This is not Tinder as a company. This is a long haul that we're signed up for here. And so if we're pushing people consistently over the edge, we're going to see churn. We're going to lose subject matter expertise. We're going to have to retrain and spend months getting new people up to speed. We can't do that. And so we have to figure out how to retain people and give them a sustainable lifestyle so they can keep contributing.
Yeah. And I love the kind of, why can I never come up with the word I want? The clarification that you made between like culture, like foundational culture, and like perk. It's not like a pool table. It's like, this is just how you're expected to be treated when you work here, and that's a huge difference.
Yeah, I think policy informs behavior. It doesn't create it. And so all we can really do as a leadership team is inform that behavior and say it's okay not to have meetings on Fridays. It's okay to take a week off in the summer. But at the end of the day, who we hire and how they interact with each other is the culture.
Yep. I'm going to get, like, instead of live, laugh, love, I'm getting that on my wall. And okay, this one's totally off script, but forgive me, everyone who's like, what is she about to say?
She's going to get there.
I will get there. My brain goes faster than my face does. So every once in a while, I'm like, go back, rewind like a couple seconds. If you have people working for you that are in burnout, and they're ready to walk circles in the same pair of pajama pants for 2 weeks, how do they approach you? Or what's the process if they're like, dude, I am like on the edge? How do they approach you to resolve that?
It's a tricky question. I think it's heavily dependent on the person and what they want to do. I think there's a couple answers. One is, I think other people see it before individuals see it. I think most people in burnout are blind to it. They just think they're tired, and I think they probably deny it to a degree. So I think more often than not, it's a manager or a coworker that speaks up and says, "Hey, I think this person's really tired right now and needs a break," which we've seen before. In the rare occasion that it is the person, it's a pretty simple conversation. I think most people know this person's working really, really hard right now and can see that already. And are like, "Ooh, this person might be burning out because they just, did a big product release and we're working some over hours." So I think it's pretty obvious when you see it. And I think it's probably less likely for a person to self-actualize than for others to call it out or notice it.
Yeah. So we all have a responsibility all together. Okay. Last culture question for me. Do you have any advice for companies that are looking to foster or create a more positive company culture?
It's just so important to hire the right people. That's what it is. You can't, I think people talk about this all the time, like creating the culture at your company, like You can't do it. You can't control how people interact with each other. You can try, and of course you try, and you have to demonstrate the behavior. And I think there's a big effect in demonstrating the behavior that you want others to portray. But at the end of the day, it comes down to who the actual people are that you're putting in the seats. If you hire a bunch of people that came from Goldman Sachs investment banking team, they are going to work nights and weekends and they're going to be cutthroat. If you hire a bunch of people that came from, I don't know, I'm trying to, this is kind of a dog if I call a company out. Some company that, let's say, overhired their engineering and their engineering had like one small project a month to do, they're not going to work that hard and they're used to that. And that's what's normal to them. And that's normal is what they're going to try to recreate. So it's so dependent on who you hire. And that's why culture should be integral in your hiring process criteria. Do not just skip by that and say, "Oh, this person's cool." There's way more dimensions to cool that you need to evaluate.
Right.
Yeah.
Yeah, we could talk for days about, getting the right team and what types of questions do you ask and what are the specific, attributes that you look for. But, I think we're just going to have to sit with what you've already said because you've already said a lot. And the folks listening to this, just basically take those principles and extrapolate those to the questions that you ask your new hires and the people you are looking to hire. And that's the way that you're going to get yourself the right team. So your team currently has just under 40 employees. And from where I've seen things, that puts you pretty squarely in the no man's land of not a small company, but not a big company. What are some of the growing pains that you've experienced between founding and scaling up to 35 plus people?
It's a great question. I think that the two that come to mind, one is, this is such a general term, but the operational scale issues. Once you get to 15, 20 people and you start adding a new person, the complexity of communication gets exponentially more difficult, right? It's not just one more person, it's one more person connected to the other 15 people. So it's 15 more lines of communication. Then you add a 16, that's 16 more lines of communication that you need to figure out. And so every time you add another person, if you don't have a system in place to facilitate that communication, it starts to get a little bit crazy. And so I think around the 15 person mark, figuring out how do we communicate, how do we set goals together, how do we keep each other up to speed on what's happening, and when expectations change on, let's just say, the delivery date of a product, how do we let everybody know so there's no surprises? So marketing doesn't release the press release and then we're like, wait a minute, we delayed this and no one told you. That's the kind of stuff that you don't want to have happen. So that's one big, I think, category. I think the second category is, how do I start building my organizational structure in a way that doesn't start to impede on itself? I'll give you an example. In the beginning, we had our engineering team divided by front-end engineers, back-end engineers, and data engineers. And we had 3, 4, or 5 people in each, and that was great. Now we're we need to change that. We can't have all of the same engineers in a group working together. We need to split them up, and we have to have multidisciplinary teams focused on mandates. We have to have a group figuring out how do we onboard customers faster and better. using technology. We have to have a team basically saying, how do we get more data sources plugged into our platform? We have to have another team saying, how do we take those data sources and normalize them to the data we have today? We have to have another team saying, how do we analyze this data and derive insights from that data for our customers? So in those worlds, we need to take one person from the back end, one person from the front end, and one person from the data team and put them on a team. And so thinking out in the future and saying, instead of just forgetting about this and loading these teams up with more people, let's design this in a way that is self-serving in the future so that we're not having to do this at a point in time that's going to be destructive. And so it's kind of like seeing around the corners. What are we going to need, and how do we design that now so that we're not in the doghouse later and have a ton of technical debt to solve for? So I think those are the two big ones, is the communication operational stuff and the system thinking of the future.
If I could jump back into kind of your team well, I don't know if it's team structure, but am I understanding you correctly in that your employees are organized in a goal orientation versus like you're a content
Functional.
writer. Haha. Yeah. I love that. That's all I had to say. I just had to make sure I understood you correctly. But like goal-oriented teams, that just makes the type A in me like really happy. So
yeah, so like we use OKRs, if you're familiar, the objective key result systems that are like from Google, I guess. And then those trickle down to departments, and departments have KPIs, the key performance indicators. And so every team has a KPI mandate. And for example, we want to onboard customers and integrate the API into their solutions in 8 weeks instead of 9 weeks this quarter. So then that team has a week or two to plan. What are we going to do? What do we think the best thing we can do is to get it from 9 weeks to 8 weeks? That becomes the quarter build, the roadmap to build something that does that. At the end of the quarter, we get to measure it. Did it work or did it not work? Did we get to 8 weeks or not?
So let's go back and talk about that communication issue. The communication needs to graduate with the size of the company, and you are experienced in creating a solution. What is the solution that you have put into place?
So I think lesson number one is don't be fooled by technology or platforms that solve this problem. They help, but they're a tool, right? If you have a hammer and you have to nail 100 nails and you don't know how to use a hammer, or you don't use the hammer very well, you're going to have a hard time nailing those nails in. You got to know how to use them, and you have to have the people in place to use them well. I think you have to have a tool to do it when you scale. You can't just use Excel or Google Sheets or something, right? So we use Notion, which is just one of those kind of project management, team management solutions. But going back to a previous comment, if I was to restart Particle again, I would start using OKRs way earlier in our careers. I think within the first week of starting Particle, I probably would have selected OKRs to start thinking about. They, I think, are probably one of the best tools of communication because it tells you quantitatively what we're trying to do this quarter and what you're working on and how what you're working on relates to those things. The example I gave earlier, we're trying to get customers onboarded from 9 weeks to 8 weeks time. There's probably 6 to 10 people on our team right now that are working on projects that contribute to that. The marketing team might be working on a getting started guide to using Particle. That might help. The engineering team is building a new version of the API that's more simple. The sales team is delivering materials during the sales process that will get our customers' engineering team ready to implement on day one instead of waiting a week to implement, right? So like, what is everybody doing, and how does that tie up to our company's goals? I think is the number one best communication tool that a founder or CEO or whoever can use. Other than that, it's like Slack and email and Notion and all these things, but it all has to be centralized around one concept. And that's why OKRs I think are really great. It doesn't have to be OKRs. It can be whatever other version of that, right? But having this, this is what we're all working on. Here's how we measure success. Here's what you're working on and why it contributes to that is the number one thing.
All right, let's shift gears. I want to talk about a phrase that I heard you use in relation to entrepreneurship. And the quote is, "It's a mindset game, after all." Can you tell us what this means to you?
Yeah. So this goes back, my last job, I was working at Startup Health. One of the core things was the entrepreneurial mindset. And it's actually a matrix that you can score yourself with on how is your entrepreneurial mindset doing today. And it's concepts like, are you long-term committed? Do you have supportive relationships in place? Are you measuring your progress iteratively? XYZ. I think those things are very important. I think at the end of the day, the decisions you're making in high frequency, I'm probably making 25 to 100 decisions a day from when I wake up to when I close my laptop, are made on the basis of your current mindset. If you are making decisions in a place of not being long-term committed or not being confidently ambitious about the future, you're probably going to make decisions that impact the future of your company. If you are sitting in a place where you're incredibly confident about the future and you feel really good about what you're building, you might make bigger bets and smarter bets, and you might think a little bit differently. So if you think about the mindset is like the platform on which you're making decisions. You have to maintain that in a good place. You have to wake up, and no matter how bad your day is going, you got to get those thoughts out and make those good decisions. You can't just let those bad feelings dictate what you're doing. You will run into bad decisions, bad news, I should say.
Mm-hmm.
I think we used to joke around about the existential threat of the week.
Mm-hmm.
The one customer you have giving you the email that says we're unplugging and we're going to stop paying you next week, right? That will happen. And if you sit there and let that get to you, you're going to fail. If you can take a 30-minute breather and go on a walk and come back and say, whatever, it doesn't matter. We're going to try to get them back. But if not, there's more customers in the pipeline that we can get that are bigger and better. You're going to make better decisions. So I think that's the foundational philosophy behind entrepreneurship is the thoughts that you're having and how those impact your decisions.
So that matrix tool that you mentioned, could you repeat what that's called just one more time?
So the group I used to work for, Startup Health, it's a venture firm, an accelerator, and they do a bunch of peer coaching and CEO coaching type stuff. They have this, I think it's on their website, I'm not sure. It's a matrix, and it is, I believe, 10 characteristics of a healthy, I think they call it the transformative entrepreneurial mindset, and you can score yourself on it. And it's a pretty handy kind of concept to understand.
So we're going to find that, and we're going to put a link to that in our show notes. And that sounds like an awesome way to measure your entrepreneurial mindset. How do you go about developing that right mindset?
It's a muscle, like anything else. What Startup Health used to do is they'd basically force you to measure yourself every month, and you would track it. I think at some point, I worked there, and they're also investors in Particle, so I'm still really, have a relationship with them. I just know it now, and I just know I'm having a bad day, or this news that I just got is affecting me, and so I need to take a breather. But it's a muscle. I think bad news now barely affects me. It definitely affects me, but I built a muscle that allows me to react to it in such a way that I can push it away and come back to it when I'm in a better place. I think reactive decision-making on bad news is a really easy trap to get stuck in as an earlier entrepreneur. You're going to have bad news. It's going to happen. You're going to have many moments of existential dread. And so it's the entrepreneurs that do well are the ones that get through it. The ones that don't do well are the ones that succumb to it. That is the core foundational truth of entrepreneurship, is who's going to last the hard times and who's going to fall down and not get back up.
All right. So I want to go back to something that you just very briefly mentioned previously. You were in healthcare, you were in VC, and then at some point you're like, nope, I'm out. What is the emotional process like when your career trajectory kind of implodes? We already heard it wasn't great, but how do you kind of, I don't know, I've heard this before from people that were like, I was supposed to be, a firefighter for my entire life, and then XYZ happened, and all of a sudden I'm a chef. How do you make that transition emotionally and mentally and kind of come out unscathed on the other side?
That's an excellent question, and I don't know if I have a real answer to this. I think the only thing I can really say is it was the only thing that got me excited. Like nothing else was exciting. And at that time in my life, that's what I wanted. I wanted excitement. I didn't want stability. I didn't want safety. I didn't want, a regular schedule. I wanted to go do something exciting. I think I was very risk tolerant at the time of my life where I didn't have anything to lose. I had like $5,000 in my bank account and like a pair of jeans. And so I was like, I'm good. Like, what are they going to do? Take my jeans away? So I was like, I can do this at very low risk to myself. And at the very worst, I go find another job. And, I was pretty confident I could probably find another job if I really needed to. Didn't want to, but I thought I could. So I was willing to do it. It was just a good kind of intersection of different feelings and at a certain time in my life that was like, this is the only thing that really makes sense to me right now.
Yeah, that's okay. That's a very good answer. I really appreciate that. I love those kind of identity questions like, how did you just turn the whole thing on your head and do something different?
Yeah.
And now to completely change directions 100%, where do you see digital health or health tech kind of going in the coming years?
That's actually a really deep question. There's a lot changing right now. I think, as we all know, the market is like collapsing. And so there will be a flip from championing companies that are growth at all cost oriented. Those companies that IPO at $10 billion, but they have like no revenue. And you're like, how is this happening? It's because they have this grand master plan that everybody's bought into and all the VCs have kind of like flocked to, and they're just supporting that because it makes money. It's going to flip from that to which of these companies are actually healthy, which ones have their eyes on profitability, which of them have good gross margins and good unit economics. That's going to happen. There's a new onus, I think, on digital health companies to prove return on investment and prove value. And I think that's a very healthy thing. I think we're going to see a lot of startups die over the next 2 years, is my guess. Which it could be argued good or bad, right? Depends on who you are. That's one. I think two, which is a little bit more specific to what we're doing, is these rules that I mentioned are going to be really big changes. In the same way that before Plaid, you could not send $5 from your bank account to your friends. This will change in healthcare too, and it's about to happen at the end of the year. The other, examples like with Plaid, like Mint and Robinhood, you couldn't buy like stocks on an app. And so like, what's going to happen in healthcare is the big question. And I think in the same way Plaid didn't know crypto was going to be a thing, and that's like their biggest business. What do we not know in healthcare that's going to happen?
Right.
There's probably going to be some big changes in the innovative space because this data has been locked up since the dawn of time. And as of October 6th of this year, it's no longer locked up. It is completely fluid and accessible by any, developer, entrepreneur, or innovative organization to develop new things on top of this data. So we're completely subscribed to this idea that there will be a Cambrian explosion of innovation in healthcare once the data is unlocked. And so we're super excited about that.
So how does a company like Particle Health scale? And what's your next step in the route to get there?
I think our plans of scale have changed as of 6 months ago with the market collapsing. Again, like the priority now is how do we turn this into a really healthy business as opposed to a growth at all cost business. And so we're not going to hire as many people as we were planning. We're not going to go for revenue targets that we were planning for. We're going to go for really healthy steps towards really healthy business metrics. So scale isn't going to be as crazy as we were thinking 6 months ago. Still, we're going to be doubling our team over the next 18 to 24 months for sure. And that comes with a whole boatload of scale complexities. The good thing is we have a really awesome leadership team that's been around the block before. And we already have a bunch of systems in place that can accommodate for a lot more people on the team. So I don't think there's any more foundational changes we're going to have to make. I think there's a lot of tweaks and iterations and nuance that we're going to have to learn as we go. But I think we have a really good foundation right now to double the size.
So let me ask a quick question on that. It seems like this growth at all costs mindset has really been driven by VCs in the past 20 years. Are you seeing support from the VC side on this more sustainable, let's actually think about making a profit type of business model? Or are they still saying, hey, growth at all costs? Are they the ones what's driving the VCs nowadays?
The biggest piece is now that the interest rates have driven up so high, buying cash is more expensive, right? And so from a venture capital's perspective, taking money from their LPs, the valuations of their companies have decreased significantly. It used to be 8 to 100x revenue as a valuation. I mean, some companies are getting valued at 200 to 300x their revenues. And it's all built on hype. It's all built on herd mentality. It's all built on the shiny new thing. And that works in that world. Now the valuations are 3 to 5x revenue, and it doesn't go higher than that.
Wow.
And so if my portfolio just went down from 50x average to 5x average, I just lost 10x of my value of my portfolio. And so the companies that I need to invest in and to support are the ones that are going to have high revenue and high multiple values from that revenue. And so it's a new game. It's just a different game. The question, though, is how long does that last? My hunch is it probably won't last that long. As soon as the interest rates go back down, the market bounces back, the VCs get a new flush of LP money. Their 10-year mandates to deploy that capital start to come towards the tail end. They're going to have to deploy that capital. I don't think it's probably going to go back to what it was a year ago, 6 months ago, which was just bananas. People were just raising insane amounts of money on nothing.
Yeah.
But I think it's going to go back closer to that. I do. It's a question of where does it land? Different VCs are going to have different mentalities too, I think.
Yeah, I learned a lot right there. All right. Yeah. We're getting closer to the end. What is the biggest lesson you've learned as an entrepreneur?
I've given most of them already, I think.
I was going to say, I'm like, is there one or are there multiple?
I'll say this. It's hard. It doesn't turn off. There's no off. You're on vacation, you're still liable to work and jump in. You are at your friend's wedding, you might get an email that you might not have to respond to, but you might read it and it might put you in a really bad mood. It becomes who you are. And there is that line disappears between you as the founder of the company and you as an individual in the world. And that's a hard thing, emotionally and psychologically to constantly be dealing with. You're in the shower, you're thinking about work. You're going to bed, you're thinking about work. You have to, like the other things, you have to build a muscle to learn how to turn it off. At some point, usually I'd say around Series A, you're starting to hire a head of sales, a head of operations, a head of marketing, whatever. You can start to offload some of that stuff. And you have to figure out how to trust those people, because you are not going to be a healthy, happy person, and you're going to make bad decisions because your mindset's going to be bad if you don't figure out how to do that. It's really, really important to figure out how to do that. You'll never be able to get it all off your table, and nor should you, but you have to figure out how to be able to turn it off sometimes. And if you don't, it's not fun. And it should be fun. It has to be fun.
Little purposeful disconnection never hurt anybody. And what is your advice for entrepreneurs? If it's that, then you can say that one again.
Yeah, just no matter how fast you think you're going to be able to start a company and get it running and sell it or whatever your goal is, it's going to take 5 times as long. And just believe that it will, if not longer. Are you ready for a 10 plus year, really intense, personality changing experience? Because that's what it is. It's a heavy load to lift and carry with you for 10 plus years. Some people just love it, right? They're like, I'm going to do this again. This is who I am. I'm happy with it. Some people are like, I can tolerate it. I can live my normal life and I can figure out how to make this work. Some people are like, I can't do this. This is just not for me. So who are you? And the sooner you figure that out, the better, I think.
All right. One last question and we'll let you get back to your afternoon. is there anything cool going on right now in Particle that you want to shout out? And how can our listeners support Particle Health?
Yeah, there's stuff I want to talk about, but I can't. I'll talk about, we are building a whole kind of new analytical layer on top of the data that we're able to pull from all these different places. And I think it's really exciting because it's changing who we are as a company, from an organization that can go get your medical records to an organization that can tell you things about those medical records. And that's a whole new world for us. And it's a wildly interesting world to be able to pull, we're on average, we're finding about 105 records per patient when we go look for their records.
Wow.
So what can you tell about somebody's health from that complete longitudinal history? And I think that within 6 months from now, we'll have some really interesting stuff built out from this. And that's really exciting for me because it's a whole new space for us to dive into.
All right. Thank you so much. We're going to put links to Particle Health into our show notes and lots of other stuff that we talked about today. But that's going to be it for today's episode of the Startup Savant podcast. Thanks for hanging out with us today. And now on to my favorite part of the show, the outro. Why is it my favorite, you ask? Because I am essentially unchecked in what I get to say to you. Whoever thought it was responsible to give me this autonomy should probably be punished. So, what am I going to do with this senseless excess of power? Well, I'll probably just ask you folks to leave us a 5-star rating on Apple Podcasts. That's not too unreasonable, right? And I might also ask you to send your thoughts about the show in an email to podcast@truic.com. But that's about it. I guess maybe our producers aren't that irresponsible after all. So I suppose I'll just do the rest like I always do. For tools, guides, videos, startup stories, and so much more, head over to truic.com. That's truic.com, TRUIC.com. See you, folks.
Bye.